Hello everyone, Dr. 𝐬𝐜𝐿 here, your local prenatal family chiropractor, and today we're going to be discussing sciatica. This is a very common term that a lot of people use, and a lot of people, think that they have problems with their sciatic nerve or come in with that low back, buttocks, leg pain. So the sciatic nerve, we're going to be discussing what it is, what sciatica is and why it occurs, and then how we go about effectively treating that. So sciatica, the sciatic is the sciatic nerve when there's pressure on it. So the sciatic nerve is the largest nerve in the human body, and so it starts in the low back area, goes down into the buttocks, and then down the leg all the way down to the bottom of your foot. So typically the symptoms you have, if you have sciatica, will be a sharp stabbing pain that is either in your low back and buttocks and then extends down into, shoots down your whole leg into your foot typically. And it's pretty debilitating when you have flare-ups of it. And so sciatica is the term when there's compression on that nerve, and it can be at any point along that nerve. Typically the most common spot is in that buttocks area, and then the low back area. So then when there's compression on the nerve in that area, then it will affect the whole nerve, whole length of that nerve. So the causes of this are our sedentary lifestyle nowadays. Even with our jobs, always sitting at a computer, if you have an office job, constantly sitting, making those hip flexors weak, and then shifting all your weight towards the back side of your body. So putting more pressure on that sciatic nerve itself. Also, obesity is also a risk factor because again, it's putting a lot of that pressure on that back side of your body, putting direct pressure on that nerve. Also, manual labor jobs. If you do a lot of heavy lifting, bending, climbing even, those things can put a lot of pressure on that nerve in the low back area especially. So that also increases your risk for that. So it's critical to address the sciatica early on, because as you go through constant pressure on a nerve, it's going to deteriorate over time. Because it's not getting the proper signaling that it needs to from the brain. So over time, your brain's going to not know that that nerve is there. So you want to go ahead and address this issue as soon as possible to try to alleviate some of that pressure off of that nerve, to help with your symptoms and pain, and then also with the function of that nerve. And the function is our utmost priority. That's what we do as chiropractors. We want to make sure that there is proper function of the nerves and a full connect between the brain and the body. So we help treat sciatica or sciatic nerve pain. We want to first make sure where the issue is stemming from, if it's coming from your low back, if it's coming from your buttocks. So we'll work on that and determine the cause of it. And then we do treatments through chiropractic adjustments, and that's to help alleviate the pressure off of the nerve itself and make sure that there is proper function and a connect between the brain and the body, brain back to the body. And then we also give you some exercises and stretches to do to also help strengthen those glute muscle area, and then also to stretch it out as well, and to work on those hip flexors and strengthen those. A lot of times too, if there's weakness in the low back, it's pretty much always stemming from your core, so we want to work on that as well to strengthen that. And so in conjunction with the chiropractic care, the exercises, adjustments, also massage therapy works great to help alleviate those glute muscles. All these in conjunction to each other are incredible care. We see great results with it, and helping people with struggling with sciatic nerve pain. So if you know someone that struggles with that, or you yourself do, we would love to help you, and I'll see you on the next video.